You've decided you're ready to become a parent, and suddenly you're overwhelmed with people who feel they have the right to inform you on the correct way to conceive, give birth, what fears you should have, and the proper way to parent. How do you filter through the opinions? How do you know what's trustworthy information and what's a myth or just plain outdated? Welcome to the Birth Ease podcast. Join your host Michelle Smith and her guests as they cut through the noise and fear by sharing valuable tips, tools, and proven methods that help you connect with your own inner wisdom as you navigate the sacred journey that is pregnancy, birth, and parenthood in a more relaxed and confident manner. This podcast does not constitute, nor is it intended, as medical advice.
Hello, Birth Ease families. Welcome to this heartfelt space. I'm your host, Michelle Smith, and I'm so grateful you are here. The month of October is Pregnancy and Infant Loss Awareness Month, and just as last year, I've chosen to dedicate the October episodes of the podcast to baby loss. I know it's a really difficult topic, yet 1 in 4 women have experienced some sort of pregnancy or infant loss. If you have not experienced it personally, chances are high that you know someone who has. And the grief of losing a child is often surrounded in silence. It's my intention to create a safe, welcoming, and informative space for not only bereaved families, and also for those who love and support them. And these episodes also will benefit my fellow birth professionals, giving them insights to the experience that bereaved families face, and sage advice from incredible experts in the field of perinatal loss. Last year's episodes feature some truly raw and beautiful conversations with Matt and Nydia, who both lost babies at 39 weeks of pregnancy. Matt provides that perspective that's not often heard, the perspective of a grieving father. Nydia shares how her faith and her spiritual beliefs sustained her after the loss of her son to a placental abruption, which unfortunately almost cost her her own life. There's also a beautiful episode with Rabbi Elisheva Brenner. She shares her own journey of faith after losing her daughter and provides inspiration for grieving families. I was also incredibly grateful to be able to interview birth and bereavement doula, chaplain, educator, Amy Wright Glenn. It's a raw and powerful episode on how to hold space for grief. There is an episode that gives tips on how to support a grieving family, and there's also a beautiful interview with Dr. Mordati. Episode 21, she shares her own journey of loss and the beautiful resource that she's created for parents expecting or wanting to conceive their rainbow baby. And if you're interested, there is also a meditation featured in last October's episodes, and it's a meditation designed for any parent or anyone grieving the loss of a child or a loved one. And this year, I am so incredibly honored and grateful for the opportunity to have this 2-part conversation with Gary Vogel, a grief expert with 30 years of experience in supporting bereaved families here in Central Florida. Gary Vogel is a licensed mental health counselor and has been in private practice since 1980 in the Central Florida area. His specialties include dealing with anxiety and depression, addictions, grief and loss, post-traumatic stress, and general life adjustment. As a clinical psychotherapist and through his own personal experience of losing his daughter Chelsea to stillbirth, Gary has helped thousands of parents struggling with the loss of a child. Gary has been facilitating the support group HEAL, Helping Endure Infant Loss, for couples who have experienced miscarriage, stillbirth, or infant loss since 1991. He has written 3 books on the subject of perinatal and neonatal loss. He has testified to House and Senate subcommittees concerning the legal issues surrounding these losses. He has appeared on national and local television and has traveled across the country speaking on the unique issues experienced by parents who have incurred the loss of a child. Gary is proud to be a member of the board of directors for the SIDS Alliance of Florida. Gary feels his greatest achievement is bringing the Angel of Hope to Central Florida, which hosts 2 ceremonies a year at the site, one on October 15th, a National Day of Remembrance for Pregnancy and Infant Loss, and December 6th, a day of remembrance at all Angel of Hope sites for parents who have lost a child. Welcome, Gary, to the Birthies podcast. I am so incredibly grateful and honored to have you here with me as I dedicate this month of October to pregnancy and infant loss awareness.
Well, thank you for having me. I appreciate it.
I'm truly so grateful. We met through a friend of mine because I attended your heal group with her when she lost her sweet boy to a placental abruption. And that experience, I have to say, was transformative. Your work has helped so many families here in Central Florida over the years. And it's profound and it's deep work. And so I was wondering if you could share with the listeners what brought you to this work.
Well, as life is a journey, it's kind of an interesting set of developments that sometimes just happen. I was a licensed mental health counselor in private practice. My specialty at the time that my wife and I got pregnant with our first child was addictions in adolescence. And I had no background in grief and loss. I didn't think that that would be something that I would be doing. So I really didn't delve into that whole realm of my profession. But on November 26, 1989, everything in my world changed. And that was the day that we lost our daughter. She was a full-term stillbirth. We lost her at 37 weeks. Her name is Chelsea. She was 7 pounds, 10 ounces, 20 inches long. She was beautiful. She was perfect. Apparently, she had died the day before her birth. And that was just such an impactful experience. My wife and I going through that. As I said, that was our first pregnancy. And so as a result of losing Chelsea, well, we attended a support group. And the facilitator of that support group did an amazing job. It was just a wonderful experience. And upon completion of that support group, the director of the Women's Center at Florida Hospital at the time contacted me and asked me if I would be interested in facilitating a support group for them. And I was interested, I was intrigued because this was such a transformative experience. But at that point, we had become pregnant again.
Oh, okay.
And one of the things, and I talk about this a lot in the HEAL group, one of the things that we lose with a pregnancy loss is the ability to look at pregnancy as a joyous thing.
Yeah.
Because we also approach it with a lot of fear and trepidation, naturally. And we lose the ability to look at pregnancy as the guarantee of bringing a baby home.
Right.
And so I knew that, in the second pregnancy. And what I told Alice McMahon is the lady that I'm talking about. What I told Alice was that if this pregnancy ended successfully, I would very much be interested in designing and facilitating a support group for couples like my wife and myself. And so the pregnancy proceeded pretty normally, as in any pregnancy, a few bumps along the way. But our son was born at 36 weeks.
Oh, wow.
We did not get an explanation as to what happened with Chelsea at 37 weeks. There was no visible evidence, and we performed an autopsy, and it came back inconclusive.
Okay.
And so as the second pregnancy with our son proceeded, our OBGYN decided that if at 36 weeks, the lungs of the baby were well developed enough that we would induce.
Okay. And that makes sense.
Yeah, and it was a very gutsy move. So at 36 weeks, we were in the hospital, and he took a sample of amniotic fluid and was looking for how oxygenated it was, which would be an indication of the lung development. And everything was fine. So that's what we did at 36 weeks. We induced. And he was 7 pounds 15 at 36 weeks.
Wow. And how old is he, may I ask?
He's 29.
29. Okay.
And as an indication of his birth weight at 36 weeks, as a matter of fact, he's 6'3" and weighs 260 pounds.
Okay. Okay.
and my wife and I are both normal sized people. So genetics is an interesting thing.
It is. It is, because my little 5'1" daughter gave birth to her first, was 9 pounds. I'm like, where did this big baby come from?
One never knows.
So, but rumor has it, my grandpa was 14 pounds when he was born. So maybe, who knows? Yeah. Wow, that's great.
So as the story progresses, to this day, I don't know how Alice, who was the director of the Women's Center, who asked me if I'd be interested in doing the group, I still don't know how she found out so quickly that he had been born.
Oh, wow.
Because it was in a different hospital system from where she worked. But he was less than a week old when she called.
Wow.
And it was very rapid. I think she didn't want me to have any moments hesitation or whatever, So I agreed. And he was born on December 1st. Throughout the pregnancy with him, I had been working on a design based upon the group that we had attended and made some changes. And so I facilitated the first HEAL group in January of 1991.
Wow.
Because he was born the 1st of December, 1990. And so I've been doing the group ever since.
Wow.
And it's one of those interesting things, that as time moves on, when I began doing the group, I never looked at it as a lifelong experience. I looked at it as, this is something I really feel the need to do to help couples going through what my wife and I had gone through, and felt like my profession gave me the perfect background to be able to do that work. And so I just felt like this is something I want to do. And I just kept doing it and kept doing it, kept doing it. And now it's been almost 30 years. That's been an amazing journey for me.
Wow. Wow. Are you planning some kind of 30th anniversary celebration or something to mark it? That's so significant. 30 years of holding space for bereaved families. That's incredible.
It has been an incredible journey for which I am very, very grateful to have had the opportunity that was given to me to do the group, and having the professional background as a licensed psychotherapist, to have the clinical expertise.
Right.
To combine those two has just been an honor. But to answer your question, no. To me, it's just, it's a milestone, and I don't want to diminish it in any way. But at the same time, I really have no plans to do anything to mark that 30th year other than go on to 31.
Yeah. Yeah.
God willing, I'm healthy and I'm still able to do the group. So I make a joke that, one of these days I'm going to be wheeling myself into the room, but as long as I can keep doing the group, I'm going to keep doing it.
That is such an amazing commitment to families. It really is. So, do you mind sharing a little bit about what a grieving family could expect if they entered into the HEAL group?
Well, as I said, the group is a structured closed group, okay, which means that it runs for a specific number of weeks, and the participants that begin the group will be the same people that end the group, okay? And I did that on purpose because I felt that the closed format for a support group, I thought, was more effective, because I use what's called a psychoeducational format, meaning that the group is a combination of myself and my co-facilitator, who is a woman by the name of Judy Kirby, who is also a licensed mental health counselor. It's a combination of her and I bringing forward certain discussion topics and presenting information in an educational format, and then opening the group up to discussion. Okay, so it's a combination of those two. I mean, she and I both have I didn't have it when I started, but I do now. She and I both have a strong background in grief and loss. Judy was one of the counselors at hospice, as a matter of fact. So while she does not have personal experience, she has a strong grief and loss background.
Okay.
So we begin the group by talking about grief in terms of what grief is and what grief isn't. Okay.
Mm-hmm.
And I think one of the biggest components of that is that most people have the thought that grieving is about death, and it is not. That's actually a fallacy. That's actually a myth. Grieving is not about death, it's about loss.
Yes.
And that becomes so significant to start to think of grief in terms of loss, because then it helps us understand what we're experiencing. And that goes to these couples that are coming through. One thing to keep in mind, for example, to really illustrate the difference, is that the intensity of our grief is directly proportional to the value to us of who we lost.
Yes.
And these people coming through this group are parents. And let's face it, you and I both know as parents, and we all know as parents, there is no one more valuable to us than our children.
Mm-hmm.
And so therefore, this is the most intense of grief experiences. Okay. And yet with a pregnancy or infant loss, often the community around the couple is diminishing the impact.
Yes.
Because it's only, quote unquote.
Yeah. Yeah. Those awful words.
I always tell the group that when dealing with the other people around you, anything that starts with at least,
Yes. Yes.
be prepared.
Yes.
Okay. But it's that kind of paradoxical dilemma of the intensity of what they're experiencing and what they're feeling versus the advice that they're being given by other people. And so one of the things we talk about in the group is we are creating a safe space with people that have experienced something similar to what they have. Okay, this loss. And in that space, be able to talk freely and openly about what they're experiencing because they're with other members, as I put it, of the same club.
Yeah. Yeah.
Okay. And no one in that room is going to diminish their experience.
Right.
And so that's where we start, is by creating that safe space, and to be able to have those open discussions and to start to think about what they're experiencing in terms of loss, not death. One of the ways in which I put that is that when we experience a loss through death, we don't grieve the death because the death is the vehicle that took them from us. We don't grieve the vehicle. We grieve the loss of that person as a part of our life.
Right.
Okay, if that makes sense.
Yeah.
So that's one of the ways in which I put it, to try to get them to adjust their thinking to think more in terms of loss.
Yeah. Well, and so often they're in shock because most of the time parents aren't mentally prepared. Like, it's kind of in the back of your mind. You hear that someone has experienced baby loss, pregnancy loss, but I just feel like there's no real way to prepare anybody for that. And it's such a devastating shock to lose your baby.
Absolutely.
It just defies the logic of how we think things are going to go.
Yeah, absolutely. And one of the losses that I talk a lot about in the group is what I call the loss of innocence.
Yes, yes.
And I think that's one of the major losses in this circumstance with a pregnancy or infant loss. Because without even knowing it, we go through life with this sense of life making sense and things happening for identifiable reasons. And the world, therefore, is very safe. When things happen for reasons, then I can construct my life in a certain way so that I ensure that those things won't happen. Even to the point of us feeling like we've got a lot more control. For example, I think a lot of us believe that if you lead a good life, if you're a responsible citizen, if you're a good person and you treat people well and you're a contributing member of society, you do all the right things, make responsible decisions, that it's almost like we're paying into an insurance policy that protects us against bad things happening to us.
Yes.
And as long as that continues and nothing bad, quote unquote, happens to us, that kind of validates that belief system that the policy is in place and I'm doing well. I continue to pay into it. And unfortunately, that's where some of the betrayal comes in and some of the anger. Because when something bad does happen, such as losing a child to a pregnancy loss, some of the anger is, well, wait a minute, I paid into that policy. Why is it not protecting me? And that why question is something I think that a lot of people really wrestle with.
Yes, I agree.
And the thing you touched upon, Michelle, I think is also significant. And that is these couples, and it's something that I say the very first night, these couples haven't just lost a child and are going through a grieving experience. The way that they lost their child and the way that they lost their innocence, because everyone will lose their innocence over their lifetime, but some people lose it gradually, small bits and pieces over decades.
Mm-hmm.
These couples lost their innocence for the most part in the blink of an eye.
Yeah.
Okay. They went from one moment, we're having a baby, everything's wonderful, to in the very next moment, hearing someone say, I'm sorry, at a sonogram, for example.
Yeah.
And their life is now totally different. And the reason that becomes significant is that what I tell these couples, you have all experienced a trauma.
Yes.
And so therefore, everyone in that room that first night, I make this clear, you all qualify for a diagnosis of PTSD.
Yes, I agree.
And so some of their journey of dealing with their loss is working through that post-traumatic stress component.
Yes. And that was something that I realized I didn't mention was the trauma. It is a traumatic, shocking event
Mm-hmm.
to lose that child. And so many families, it can create PTSD.
Absolutely.
Or families with babies in the NICU
Mm-hmm.
can create PTSD. And then some babies go home and some don't, unfortunately. And that adds to that trauma.
Mm-hmm. Mm-hmm. Absolutely. And see, going back to that loss of innocence and what that innocence is about is that, yes, we cognitively know that people experience pregnancy loss. We cognitively know that you mentioned NICU experience, for example. We cognitively know that all babies don't come out of the NICU alive.
Mm-hmm.
But with our innocence intact, we firmly believe that that will not be us. That will not be our experience.
Right.
Until suddenly it is.
Yeah.
And again, there comes that traumatic component. And then, at that point, everything changes.
Yeah.
Our life view changes.
Yeah.
But again, it changes in the blink of an eye. And that's a huge life adjustment. And it's a difficult one.
It is. It is. And, one of the definitions that I've heard that can set the stage for PTSD is when we feel like we can't perform the duty that we were assigned. Like police officers, firefighters, for example, they may perform their duty and there's traumas along the way, but what can create that PTSD is those times when they couldn't fulfill the duty that they were assigned.
Right.
And so if you think about it from that aspect of being a pregnant person, and as a mother, your job is to grow and protect that baby, and something happens to the baby, it just sets the ground for so many women blame themselves. They can get into this circular thought pattern of it's their fault. If only I hadn't done this, if only I hadn't done that. And I feel like it's just the nature of motherhood on one hand, but that I didn't fulfill my duty of nurturing this child adds this big component to the trauma. Am I making any sense?
Oh yeah, absolutely, absolutely. And you're touching on one of the differences in this experience for moms versus dads. And I designed the group for couples because I want them to both come in if they're willing. I'm not going to force anybody, obviously, but we talk a lot about the difference in this experience for moms and dads. And you're touching on that sense of guilt, which is attached to that built-in sense of biological responsibility that a mom has for a child that she's carrying, okay, that clearly a dad is not going to experience.
Mm-hmm.
And you're right on target. Moms will feel a sense of failure with a pregnancy loss that dads will not. We spent one night in the Heal group talking about the differences in how we grieve as moms and dads. And I think one of the major components of that is recognizing not only do we grieve differently as the masculine versus feminine beings that we are, but in this particular situation, what we're grieving is different because the loss is different for moms versus dads. A mom with that sense of failure, for example, I've heard many moms over the years express a feeling that they felt like their femininity had betrayed them.
Mm-hmm.
Because carrying a child, bringing a child into this world is a part of the feminine identity. Okay. And so having failed at that, many women will express that feeling of failure and therefore express that sense that, and especially like in our case, especially if it's a first pregnancy, many women, will wonder, can I do this? Am I capable of doing something for which I'm biologically designed?
Right.
And so, like I said, especially in a first pregnancy, and my wife very much expressed this, that will be a part of a mom's experience. Well, again, for a dad, that's not going to be a part of his experience at all. One of the ways in which I really express the difference is that I talk about the fact that those differences begin in one moment, and that is the moment of conception.
Mm.
Because at that moment, a man's sense of built-in biological responsibility ends with conception, and with conception ends successfully. Okay. But at that very same moment, that sense of biological responsibility is transferred to the mom. So now she is going to feel very much this built-in biological sense of responsibility for this child. And I think that that's the major component in terms of why when a pregnancy does not end successfully, that a mom will feel a sense of guilt and failure,
Right.
that a dad just won't experience.
Right. In my experience of being pregnant 5 times, I did have a miscarriage. I have 4 living children. And in working with families for 20 years, that some fathers, and this isn't true for all, but there are some that it's kind of difficult for them to bond with a baby until the baby's born. It's like the baby's not quite real till they can hold it or touch it. And for some, even the baby's not a person almost till they're about 1.5 and they can talk and play. Not that they don't love their baby, they just haven't been able to create that bonding that the pregnant person's carrying that baby can begin to bond from the moment they realize they're pregnant, or even as they're wanting to conceive. And so I would think in some ways that could impact the way that a father grieves.
Absolutely. And you're right on target. For some men, they don't emotionally bond until that baby is in their arms. Now, that's not true of all men. For some couples, they will emotionally bond with the baby when they're laying in bed at 6 months, playing Name That Bump.
Yeah. Or when they conceive.
Right. It's at a different point.
Yeah.
And people ask me a lot, in doing this work, people ask me a lot, at what point, and I'm going to say it this way very, very purposefully, at what point should, purposeful use of that word there, at what point should we grieve the loss of a pregnancy? Okay. And let me say, kind of make a side statement here. I object to the term pregnancy loss because pregnancy is a medical condition. We're not grieving the loss of a medical condition. We're grieving the loss of a baby.
Yeah.
And so I even have a prejudice against, the term pregnancy loss. But going back to what I was saying originally and being asked that question, what point should we grieve the loss? And I know that what the person who's asking me that question, they're looking for something definitive. They're looking for a number of weeks gestation. That's what they're looking for. But it's not about the number.
Right. It's not.
It's about when emotional bonding takes place.
Mm-hmm.
And that's going to be different for every individual, both moms and dads. I've had moms come through the group for ectopic pregnancies. I've had moms come through the group for chemical pregnancies.
Mm-hmm.
And as you said, looking at a mom going through infertility issues, for example.
Yes.
They're bonding with their baby even as they're going through that process. And I just got a text, as a matter of fact, from one of my clients who's going through the infertility process. She's going through IVF. And she just texted me this morning that she's got to change her appointment for next week because she's got an appointment with her infertility doc. And as a mom is going through that process, each time when they get the news that it didn't implant or it didn't take or whatever, there's loss.
Yes.
Because she's emotionally invested in just the idea of her baby. This mom, for example, has a very well-conceived idea in her mind as to who her baby is.
Mm.
And so, she's going through almost a continual loss, every time she gets the news that they're having to go through another round or whatever the case may be.
Right.
So again, it's significant to look at it again from a loss perspective.
Yeah, I agree. So, do you mind touching on some of the differences that can happen when people grieve, couples grieve? I know it's not completely black and white per se, but as a whole, men can grieve differently than women.
Mm-hmm.
And could you touch on some of those differences? Some of the main ones that could be helpful to the listeners?
Yeah, absolutely. That's, as a matter of fact, that's one of my favorite topics.
It's an important one.
Well, I think it's a very important one. And one of the things that I say about grief is that there are so many components that define grief, so many components that affect how we grieve, that grief is like fingerprints. It's that individual. Every single person will grieve differently. And that's why I say that it's like fingerprints. It's that individual. But to concentrate on the differences between how men and women grieve, and especially in this context, and again, we spend one whole night in the HEAL group talking about the differences in how we grieve as men and as women. All right. And to just briefly outline it, and I'll start with a male experience, partly because that's the one I'm most familiar with myself.
Mm-hmm.
Men tend to, and this is the way that I always put it, tend to, it's not an absolute, because again, we're all different. Men tend to grieve very cognitively. Men tend to approach grief as a problem to solve, and will go about solving the problem in the most effective, efficient, practical way possible. Okay? Meaning that men are thinking their way through their approach to their grief. Okay? Therefore, for men, it's a very solitary experience because it's an internal one. Okay? They're trying to cognitively figure it out, and they'll approach it from that standpoint. Okay? Now, the switch over, for women, for the most part, women tend to grieve affectively, emotionally. They're processing this loss experience through the filter of emotion. And part of what that means is that as these emotions are surfacing and being expressed, for women, it's much more of an external experience.
Mm-hmm.
Okay, one of the ways in which I describe the difference is the difference between grief and mourning. Grief being the internal process of incorporating a loss into our lives. Mourning being how we externalize that process. So, we could say that men tend to grieve, women tend to mourn. Okay.
Mm-hmm.
Just to kind of make it very simplistic. But to go back to women, because I think this is also a major component, in that for women, it tends to be much more of an external experience and therefore visible. It also is a much more social experience for women. For men, it's not a social experience. It's not a shared experience because it's a cognitive internal experience. It's not visible on the outside.
Okay.
And so therefore, men tend to approach grieving very solitarily. I had a dad many years ago was a regional salesperson, and he talked about driving all over the state of Florida. And he talked about doing all of his grieving during his windshield time.
Mm-hmm.
When he's in the car by himself. And when he would return home, he's already done all of his processing internally by himself.
Okay.
Okay. Therefore, he's not likely to share that with his wife when he gets home. The other thing is too, and again, for men, grieving being such cognitive experience, they'll tend to rely on what cognitively makes sense to them. And if under these circumstances, they see their partner struggling in ways that they've never seen before, they see their partner in more pain and more agony than they've ever experienced. They see her in more pain than they think anyone could possibly endure. They will not share their pain with her because it doesn't make sense to give someone more pain when they've already got more than enough.
Okay.
A dad will cognitively think that through, and I'm not willing to share my pain with her. She's got more on her plate than she can handle. Why would I want to give her mine too? And that's kind of that cognitive approach, that most men will go through. What they don't understand, this is the purpose of us having this discussion here in this format and, in the Heal Group. What they don't understand is that by sharing their pain with their partner, they're validating her pain.
Right.
Okay. And that validation is a huge component. And also what they don't understand is because they're not sharing their experience with their partner and they're grieving solitarily, often moms will believe that he's not grieving at all.
Right.
Because they don't see it.
Right. Right.
All right. So therefore sharing it with her becomes even more important.
Right. And then she doesn't feel so alone in her grief.
That is the whole point. Absolutely.
Yeah.
Moms need to know that this is an experience we're going through together.
Yeah.
And unfortunately, if a dad is grieving, again, solitarily and not sharing any of what he's going through, he's not sharing his pain, she doesn't know that.
Yeah. So do you have some tips to help prevent? It feels like it's miscommunication.
It is.
And in my experience too, sometimes I feel like men by nature, they want to fix things, right? They want to take care of their partner, and they're so busy taking care of their partner.
Absolutely. Again, and that's a part of men approaching grieving as a problem to solve. They're trying to fix it.
Mm-hmm.
Okay. And okay, they come up with a cognitive solution and they can fix their own struggle. Where the conflict comes in is when they try to fix their partner.
Yeah.
With using the same tools that worked for them.
Right.
And so I think the biggest thing is recognizing that we do grieve differently. As a couple, that we're both working our way through this loss, but we're doing it in our own separate and distinct ways. I think it's important for moms to not fall into the trap of thinking of their partner that because I can't see him grieving, that he's not.
Right.
Okay. And I think the trap in reverse for a dad is thinking she needs to grieve my way because it's easier.
Mm.
All right. And that's where the conflict comes into play. When either party tries to impose their style of grieving on the other. That's frankly, the divorce rate after the loss of a child is twice the national average.
That's what I was thinking, is how this significant loss can affect a marriage and create devastation through it. And if you don't have skills and support, it makes sense that the divorce rate would be so high.
Yeah, like I said, it's divorce rate after the loss of a child is twice the national average.
Wow.
And that's enormous.
Mm-hmm.
And yet, one of the things that I have found in all the years that I've been doing this work and doing the Heal Group is that this loss is going to have an enormous impact on a relationship.
Mm-hmm.
And it will do one of two things to a relationship. It will either tear it apart or it will make it stronger. There is no neutral.
Yeah. Yeah.
Now, I think the powerful thing of that recognition is which one of this is up to people in the relationship.
Right.
It's about choice.
Right.
You know, one of the things that I discovered in my own marriage when we lost Chelsea is that, yes, my wife and I grieved very differently, but we were able to understand that we were just grieving differently, that we were both grieving. And the impact on my marriage was it made it incredibly stronger. Because if, as a participant in this choice relationship of marriage, when we realize that if our marriage can survive the loss of a child, it can survive anything.
Yeah. Yeah.
You know, and frankly, that came to be significant for us when our son, who was born the year after Chelsea, when he was a toddler, my wife was diagnosed with breast cancer.
Oh my.
She found a tumor in her left breast, and she was stage 3.
Oh my goodness.
So it was a very serious diagnosis, and she went through surgery, chemo, and radiation. You know, and so that was a hellacious year for us. But we never once thought that her diagnosis and what we were going through and the stresses and strains of dealing with cancer, we never once thought that was going to affect our marriage. Because compared to the loss of Chelsea, and I say this in this way, cancer was a cakewalk.
Yeah.
You know, cancer was nothing. You know, not to diminish the impact of cancer, but as far as the impact on our relationship and our questioning, will it affect negatively our relationship? No, we never once thought that.
Right. That profound grief and trauma, if we do, I don't know if work is the right word, but.
Oh, I think it is the right word.
Okay.
Grief is work.
Yeah.
It is hard work.
Yeah.
Okay. And most people tend to think, you know, going back to Elizabeth Kubler-Ross's work in the mid-'80s, you know, and the stages of grief thing that has been enculturated over the years. Okay.
Right.
Well, that stage theory kind of gives the impression that grief is a passive experience, that you just allow it to go as it goes. And, you know, you're in this stage or you're in that stage, and next will become this stage. And it almost makes it sound like a checklist
Right.
of experiences that is very passive. And the reality is so very different than that.
Yeah.
I think what's much more to the point is task model in grieving. I've always taught a 3-task model in grieving. The first task being to admit to ourselves this new reality, the loss being a part of that. The second task being accept this new reality, which is where all the emotional work is done. You know, the anger and the guilt and the resentment, and, you know, we're doing all of that emotional work. And the third task is adapting to this new reality.
Yeah.
Now,
Yeah.
because the real work of grief is not to forget and to put it behind us and move on. The real work is about incorporation. We incorporate the loss into our lives. You know, and that's where that adapting comes into play. And I think that that's in the loss of a child. I think that's even more significant and more important, because when you lose a child, you lose the opportunity to parent that child, but you don't lose the need to parent that child.
Yes.
So the need continues. And so, in our case, for example, our daughter is a part of our lives. I say this to people when I get asked, how many children do you have? I have two, one living, one not.
Mm.
She's a part of our lives. She's part of our family. We have 4 stockings hung every Christmas, one with her name on it.
Mm.
Because it's about remembering it, and it's about making sure that this person, in this case our child, has their place in our family structure. And that doesn't go away.
Right. Right. And that's so different from years before, where moms weren't even allowed to see their baby. The baby was a stillborn, or you were just told to move on, and there was no incorporating, no honoring of that significant person.
Yeah, that's a big component, because most of us have never had our emotional resources tested to the point like losing a child. And let's face it, most of us, and you shared your experience in a miscarriage, but most of us would have looked at someone experiencing a tragedy, and most of us would have said, gosh, I could never survive that.
Mm-hmm.
Partly because that's never been tested to that point.
Right.
And it's only when we have gone through an experience like losing a child and we've survived it, and not only survived it, we've come out of the experience a better person, because we're deepened, we're enriched by this experience. We look at things differently. And then we really start to understand how resilient we are as the human beings that we are.
Yeah. Yeah. That's what I have so many thoughts as you said that, but even with the pandemic, that can be one of the things that comes out of it, because I feel like we're all grieving globally. There's so many losses.
Oh, yeah.
Yeah, and it's compounding grief for many of us, but we can create a resiliency. There is a resiliency to the human spirit.
Absolutely. We are extremely resilient creatures, in all honesty. But again, most of us have not had circumstances in our lives that test that, and therefore help us really believe in our own resiliency.
Right.
And you're right. And in our current circumstances with COVID-19, we're all experiencing tremendous loss. The loss of freedom, the loss of the freedom to be able to go where I want to go and do what I want to do, and go out to dinner with the important person in my life when I want to do that. There's tremendous loss in this experience. So yes, we're all grieving.
Yeah, to be able to see and touch family.
Mm-hmm. Yeah.
And that's a huge loss there.
Mm-hmm. Well, I think one of the biggest losses, and I say this a lot for myself, I miss hugs.
Mm-hmm.
And so there's that loss of that connectedness that is what a hug is all about.
Yeah.
So yeah, there's all kinds of losses.
What you just said is making me a little teary, because it's Wednesday on the 30th. It will be the 1-year anniversary of my stepmom passing. And I went to my father's, and we're trying to be so careful with COVID because he has some health concerns or conditions that could make it quite dangerous if he contracted COVID. And anyway, he looked at me and he just said, I need a hug. I need a hug. And then he cried on my shoulder and cried over his beloved.
Mm-hmm.
And we need that connection. And I feel like COVID has interfered with our ability to grieve together, because I try to time when I see him, make sure I've quarantined for a bit, because his health is a little more fragile. So I'm thinking that this pandemic must be impacting bereaved families so significantly.
Yeah, you're exactly right, because it eliminates really, or at least very much challenges our ability to support each other and connect with each other as we grieve. And I feel so badly for the families. And my sister's husband, about a month ago, lost an aunt to COVID-19.
Oh, my.
And I was talking to my sister about that. And, the family's just torn apart by the loss of her aunt, naturally.
Yeah.
But they're also torn apart because they can't grieve and support each other the way we're used to and the way we need.
Right. For the most part, our culture doesn't grieve that well anyway.
No, because going back to that stages theory, because we look at it as, something that you just kind of go through.
Yeah, it's been 2 weeks. You should be done.
Yeah, you should be over it.
Yeah.
Move on.
Yeah.
Well, in most American businesses, for example, if they have a bereavement leave policy at all, it's usually about 3 days.
3 days, I know.
Which gives the impression that it's something that you should, quote unquote, be over in 3 days.
Yeah.
And the truth is far from that.
Yeah, I agree. In the second half of our conversation, Gary and I will discuss the beautiful story of how Central Florida got their own Angel of Hope statue. The links to the Heal group and other baby loss resources will be in the show notes. And please, if you're listening to this because you have experienced the unthinkable of losing your baby, please remember to be gentle and compassionate with yourself. And if you're listening in support of someone you love, then one of the best things you can do is simply listen, and say their baby's name. Remember that grief is a journey unique to each person.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birtheaseservices.com/podcast. For more information on the Birth Ease method, Michelle's classes, meditations, and other services, go to birtheaseservices.com.